Hi everyone and welcome to Crushing Doubts Q&A, Mondays, 6 p.m. Eastern, 3 p.m. Pacific. We are 5 minutes late and it's because of technical issues because I am shooting on location. But we are here as always on YouTube, on Instagram, and Courtney, I believe you're going to feed me questions that come in from Facebook, so we've got all of that ready to go. We do have preloaded questions, but as you guys know, we often don't get to those preloaded questions these days because there's a lot of activity on the site. I'll get to as many as I can. I'll answer as many questions as possible, all mind-body stuff. Just a reminder, if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below. Of course, I'm talking to people on YouTube. On Instagram, I see MC94554 is here. Oh, that's Debbie Rosso. Good to see you. Chuck Brown Productions, I see you. Terry and Mark Campbell, good to see you. So, why don't we bring up a preloaded question? We actually have time to do it. I can't believe it. So, bring that up in the screen, Courtney, and let me move this out of the way. We've got a little things to adjust to. Okay. This is from Natalie B., all the way from Australia. The doubt part is fear, a fear of another's symptom. She's talking about the doubts that she's having, because as persistent and at times debilitating as this is, I have had much worse before. Neck pain and headaches and elbow, hand, feet pains, etc. all impacted my ability to work properly so much more than this does. Part of me isn't prepared to swap out, meaning the symptoms, even for a short time. I'm trying to convince my brain to let go of that fear. Okay, so this is an important question that is really about what happens when you weigh your different symptoms. Something that I talk about is TMS bargaining, which, of course, tension myositis syndrome is what Sarno called mind-body issues. And the bargaining idea is that we keep it in our minds that, in a way, we almost feel like we have to have a symptom. We almost don't believe that we could get free of all symptoms. And one of the things you want to keep pushing back on in terms of doubt, because that's a way that doubt can really creep in, is to make sure that you are certain that you are pushing back on the idea that there doesn't have to be any symptom. None. That's a way that doubt can creep in, and that's why I say no bargaining in TMS. If you start bargaining, then it knows it can creep in at a certain point. I see Katie Francis has joined us, and Sarah Fink. Good to see you, Sarah. It's been a while. I see Jill and Julie are saying hi on YouTube, so hello. And I can't believe it. We're actually going to get to a second preloaded question. This is a new record. We haven't had this happen in quite a while, so let's bring one up. Okay, hold on one second. All right, this one is from Russell K. He says, Dan, would you say pain that ensues following stretching/yoga without the presence of any blunt force trauma is definitively a trigger? I think there was an extra A in there. My bad or his bad, I don't know. No worries, Russell, if it was you. Yes, listen, any injury, any feeling of injury that did not come with a blunt force trauma or a cut, it is a mind-body symptom. I know it can be hard to believe because they are so real. And just remember, they are real. This is all real. No one's saying anything, any of this is not real. But I know that feeling. I even have it right now. I've got a pain back here just at the moment. And I can think through why. I'll use my columns. But the fact is, it feels like something that is purely physical, because it is purely physical in a way, but I don't like the word purely there because it throws out the idea of the mind-body process. So if you've got pain that happens following any activity and you didn't have a direct, very obvious collision, then that is a mind-body experience. Now, on top of it, if you have a symptom after a blunt force collision, you can still be having a mind-body issue. So try to keep that in mind. It can be a mix of the two. But if there was no clear physical issue, and movement-related things do not apply. As hard as it may be for some of you to believe, we can talk it through more, but I promise you, movement-related things don't cause mind-body issues. I've challenged them successfully over and over and over in some surprising ways where it really hurt. And I was like, I injured myself for sure. Challenged it, and it went away. And as you get stronger in your belief system, that will happen more often. We've got a question coming in from Instagram, and then I see Molly has a question on on YouTube, and she said hi also, so good to see you. Rhonda, good to see you. Dorisa, good to see you. Okay, question coming in from Instagram. Have you helped someone recover from full body burning CRPS? That's complex regional pain syndrome. It's funny because there's so many acronyms these days that I try to keep track of the ones that I need to know, but there's so many of them. The main thing you want to keep in mind is that all of these different acronyms really end up feeding into the same thing. This is all mind body. I have helped someone recover from full body burning, actually. Yeah. Now, what that means is that the symptoms feel in your sensory experience that you're burning all over the place, and this can happen in varying degrees. I've also helped people with, localized burning of various kinds. One of the advantages of having done this work as much as I have and with as many people as I have is you end up seeing everything. I have seen just an endless amount of symptoms in a variety of ways. So I think that was Debbie asking that question on Instagram. Yes, I have helped with that. Do not lose hope about that. I will say this. When you have a symptom, the stronger the symptom is, the more likely it is to cause some doubt, and I understand that. But it all works the same. Don't panic about the level of doubt. Don't panic about the level of symptom. It's all about doubt. And we'll keep working at the columns to get that under control. Okay, question from Molly on YouTube. She has burning mouth syndrome, so burning seems to be a bit of a theme today. She says, my burning mouth syndrome is gone now. Oh, yes, Molly. That is very exciting. Like totally gone for over 2 weeks. Not sure why. But have to give credit to learning about the mind-body connection and drinking lemon water. Okay, so I know I didn't prescribe the lemon water, but, whatever works, that's great. I do think, though, one of the things that people find is that the longer you push back on these symptoms, the more that you push back against doubt, you do eventually begin to make progress. It's in the little breaks that we take from pushing on doubt that doubt finds its way into the cracks. So keep in mind, keep at it. The more you do it, the more you practice, the more you make progress against doubt. I do also want to say for the Instagram people, I'm at a different angle than usual because I'm at a different location, but hopefully it's working out for you, and I will make sure to keep checking in with you some. Okay, Robert McNellis says hello from Bob. Good to see you, Bob, or hear from you anyway. Let me know if you have any questions. Okay, Molly says, my emotions have been so chill lately that I feel like I am me again. Yeah, I mean, it does sound like you've had a breakthrough. Well, more than it sounds like. We know you've had a breakthrough. The body's telling us you've had a breakthrough. So think about it that way. The body never lies. It always tells what's going on. And it's a really nice thing that you're having this adjustment. Very clearly, your mind is settling down. I think, I don't know if it's the column system or just thinking about things in a particularly good way for you, but spending time and getting calm and confident changes everything. And it sounds like that's really been the case, Molly. I'm really happy to hear it. That's wonderful. Okay. Terry from Instagram says, actually, it's fun to see a little behind the scenes. Well, maybe we'll do some more behind the scenes as time goes. We could do a behind the scenes documentary at some point. But thank you, Terry. She says, also, can you please talk about combating attentional TMS? Okay, so we talk about this a lot. Attentional TMS is essentially when you cannot get your mind off of the symptoms. And it alone can cause a lot of symptomatology just from thinking about it over and over. In fact, I've sometimes said, if I concentrate on a particular part of my body, I can make it hurt. Not that I would want to, but it's indicative of how insidious attentional TMS is. Now, I've had questions about this as to what column does attentional TMS fit into. I put it in the power column, actually, even though it seems like it would be very doubt related. And I suppose at some level it is, because in my system, everything is doubt at its base. But the place where attentional TMS really resides is in what I would call third level doubt. Can I stop the symptoms? Well, attentional TMS is a form of third level doubt. It's basically you saying, I can't get my mind off it. I cannot stop. So it funnels its way into that third level doubt. And because that's so power column related, that's where you want to think about it. In the power column, the thing I want you to think about attentional TMS is you're not gonna conquer it directly. The more you deal with it directly, the more you get focused on it, and the more it feeds itself. That's what attentional TMS does. So what you really want to do is, it's not distract yourself off of it entirely, although that is what ends up happening. You want to focus on your core narrative, who you are, and where you need to be going in your life. If you are in the center of your power column and what you need to be doing, attentional TMS just goes away on its own. I'm not saying it's easy, but that's the basic gist. Jasper, good to see you on Instagram. Okay, so Jill Kleeman is saying, could this be an emotions theme? The world is not a safe place. Absolutely, Jill. In fact, that is an outstanding emotions column theme. It's one that I would say is one of the major ones that applies. Now, I will say this. You have developed the broad part of the theme. But as a reminder to everybody, when you're building your themes, you want a broad aspect of it. It's got to be high stakes, which you hear that this is. And it also has to be specific. That's the one part that's missing from your theme, Jill, but you're well on your way. The world not being a safe place, that can cause a lot of symptoms. So what I want you to do now, Jill, is to build in a part of the specifics of how it didn't feel safe for you. And the reason I want you to do that is that we are always trying to match a present day experience with past events, because that is the way that we can use the emotions column. That's the way we can look at a given situation and say, this is happening in the present, and it reminds me of all these times when this happened. That's when you get specific and you really nail that theme. So, Jill, you're on the right track. Let's keep working at it. Julie Eby says, Jill Kleeman, that's part of my core narrative. So, listen, you guys, we're a great community that is connecting in lots of ways. And one of the ways that we connect is we're going to start to see a lot of overlap between themes, especially in the broad, high stakes aspect of things. In the specifics is where we might have some big differences. But safety, I can pretty much guarantee you almost everybody out there has a theme that relates to safety in some way, or at least a feeling of security, all kinds of things related to safety. So thank you for sharing, Julie, and thank you for sharing, Jill. Okay, Christy, good to see you here. Christy says, hi, Dan. Watched your videos on being in trauma. I'm recognizing when that occurs, but what can I do? Just sitting with the feeling? Sometimes this occurs at work or when I cannot find that time alone. Okay, fantastic question, Courtney. Let's leave this one up here. There's multiple parts to this answer. So first of all, I'm glad we're talking about trauma. There are a lot of people asking me about it, and I have to say, I'm continuing to develop my system in a variety of ways. When I recognized that trauma was one of the main things getting in the way of people using the system, I knew that I had to make some kind of adaptations. And that is when I released those videos on trauma and how to think about it in relation to the columns. So I think they're helpful. It sounds like Christy got help from them as well. But now she's asking the next question. What do I do? Once I've recognized I'm in trauma, what specifically do I do? Now, sometimes you do want to sit with the feeling, yes. But as Christy's pointing out, sometimes you can't. Sometimes you're at work. Now, this might strike you guys as kind of amusing in a certain way, or at least enlightening. There have been a couple of times where I have had to shoot a podcast while I was in trauma. I knew that I was. So it's not that you cannot function. You can function. And I encourage you, go on functioning as best as you can. But there's a couple things you want to do. One, first of all, you want to have some empathy for yourself. Extra empathy at those moments. These are very hard moments. And you also have to factor in, maybe other people wouldn't think that they're moments to empathize about. You have to throw those ideas out. No one else gets to decide whether you get empathy at a given moment. So the first step when you're in trauma and you've recognized it is empathy. One other step, you have to work against panic. If you can do one thing when you're in trauma, it's work against panic. And I'm going to tell you the way to do it. You want to work against panic by saying to yourself, none of this is going to last. Trauma actually doesn't last that long. And that's good news. Trauma does not last more than 24 hours. Now, you can get trauma activated again further, and that can happen so that you could be in trauma for weeks at a time. But it's multiple traumas. It's kind of like how chronic is not the right word. Consistently acute is the right phraseology for our supposedly chronic symptoms. Well, the same thing is true with trauma. You're not in trauma beyond 24 hours, probably even less than that. But generally speaking, I find once people go to sleep when they've been in trauma, the brain works on all of these things. You do not wake up in trauma again unless the trauma was coming from the dream. So dial down the panic. And remember, you do not have to do anything in those given moments. If you're in trauma, that's not really the time even to do the columns work so much, but you can. Don't feel like you can't do it. Just dial down the expectations a little bit for yourself so that you're being kinder to yourself about it. Christy, do some follow-up questions on that if you need to, okay? On Instagram, I'm noticing Jasper is, Terry said hi to Jasper. They were in the seminar together, so they're like, mind-body friends. Jasper says, made it just in time. Thanks. Hi, guys. Good to see you, Jasper. Great to have you here. Okay, now we've got a question from Molly. Actually, she's talking to Jill Kleeman, so let me see. She says, I believe not feeling the world is safe will cause symptoms. It did with me. Now I am better with thinking this through. So this fits with what Christy's question was. Molly, I think you've gotten better in the last couple of weeks with trauma. Or maybe not even with trauma, but with staying in a place where you're not panicked. So that's going to bring your symptoms way down. And, people talk about all those exercises, mindfulness exercises, meditations, all kinds of things to calm down your nervous system, and they are great. But you got to remember, you can do it with your mind process too, your conscious mind experience where you say to yourself, hey, I can calm myself down here. I'm not going to be stuck here forever. So keep calming yourself down, and you guys will do a great job. Okay, Molly also says, I can make a part of my body twitch if I think about it too. This following along what I was saying, which reminds me how much the mind controls the body. Absolutely. It is staggering how much the mind controls the body. And I find the more I study it and the more I think about it, the easier it is to settle in about the fact that I don't need to worry about any of these symptoms. None of them will last. They're all moment to moment. The mind and the body are working on it all the time. And I've also come to have a lot of trust in both my body and my mind. So we'll keep working at these things. Okay, Jill says to Molly, they're having a conversation here. This is good. Community. Jill says, all this COVID stuff has got me so stressed. I don't know how to deal with the stress when COVID is real and such a huge problem right now. Molly says, I hope you guys don't mind I'm reporting on your conversation, but it is happening in the feed, so I assume it's okay. Molly says, I am the same, but lately have been telling myself I cannot control this and just do what I can. Also, do not watch the news. And then Jill said, I never watch the news, but recently I was in the hospital due to chest pressure. I'm so sorry to hear that, Jill. I was sent to the hospital after being tested for COVID, which was negative. Haven't had any chest issues since. But I was sent to the ER due to some irregularities in my EKG. I had absolutely no chest issues since the negative COVID test. This, and then Molly was asking, wow, this is a burgeoning conversation. She asked, was your chest pain due to anxiety? And Jill says, I really think it was. So this shows you, this kind of talking that we can do as a community, by the way, is really important. Whether we're doing it in the Q&As or if you're doing it in the Mind-Body Connection group on Facebook, or you're doing it in a group with me or whatever, or in a seminar. I am finding more and more that the group aspect of the work is incredibly important. And this is something that Arlene Feinblatt said in her interview with me and has really stuck with me, that a lot of times you guys do great work with each other. Now, look, there are times where you might end up setting off each other in some way, or one person worries about one thing and it spins into another, and that's where I can come in and kind of calm it down. But keep in mind that the group experience here can be very important. You can do a lot of good work here, helping each other to see it. And the more we talk about this, the better it gets. So one thing that was noted, I think last week, or maybe 2 weeks ago, is that these conversations on the Q&A actually are getting even more sophisticated. And it's because the group, and the community at large is understanding more and more about this. So they'll say, well, I understand this, but now what about this? Christy's question about trauma, for example. You guys are recognizing how to recognize when you're in trauma, but what next? So again, Christy, let me know if I did answer that question well enough. Okay, let's see. Julie has weighed in on this conversation too, so I just wanted to read that, and then we'll get to another question. Julie says, Jill Kleeman, I have an irregular EKG, but normal for me. After being put in the hospital and almost again, I now carry a copy of my EKG. Yeah, so listen, when we start to get monitored by doctors, I say this all the time, get checked out by doctors when you're in doubt. They need to have a look at you to determine, make sure everything's safe. But once you're past that point, the repeated findings that they have, whether it's an abnormal EKG or things like that, what they're really showing is if you're studying something all the time, you're going to get a lot of data. And that data is not always going to be, it's not always going to be relevant in any way. In fact, usually it is not. I'm not saying to disregard medical diagnoses, by the way, but if they've made a medical diagnosis that is one of these basket terms that don't really make sense, you can actually dismiss that, as long as they have ruled out anything that is major in the medical department. So keep thinking about this. But my rule of thumb, I see a doctor once a year for a checkup. And when I go, I listen out for life and death stuff. But otherwise, I tune out a lot because I shouldn't say I tune out, because what I do is I do take in, but I have a tendency to, or I have it in my repertoire to dismiss what the doctor's saying if it's not helpful. I said this, I believe, last time, actually, or I was saying it to someone recently. I talk to a lot of people these days, so I don't know. My daughter, I brought her to get her second COVID vaccine. No, it actually was a different vaccine. It was, for her 12-year-old checkup. And she had to get an injection or some kind of vaccine. And the nurse said, move that around because it'll hurt. I said, the nurse left the room. I said, listen, dismiss that information. We don't know that that's going to hurt. Then she went home and it didn't hurt. And then she said, well, my shoulder is kind of hurting. And I was like, where? And she showed me. And then she started laughing and she said, oh, this isn't the right shoulder. So these kinds of things can happen all the time. It is amazing how powerful the mind is and all that it is generating in terms of all these different symptoms. Okay, we've got a question coming in from Instagram. Jasper, good to see you here, as I mentioned. My friend and I share the same TMS symptom. However, he is able to perform and I am not. Is my trauma worse than his, the reason why we have possible different levels of pain? Great question. Jasper, it could be that, but my hunch is that is not it. My hunch is that your fear is greater than his. Generally speaking, it is not the level of trauma that determines how much these symptoms stay. It's the confidence level, it is the certainty, and the level of fear. So that's good news, I would say, and I hope you would too, that this means you can challenge it. And let's keep working at it. We will get you there. As soon as you're confident, you'll get there. Think about it this way. I'm a sports fan, but I'm also a music fan. And both are performances. And the people who are more confident and less worried about things tend to perform significantly better by a huge margin. In fact, like in basketball, Michael Jordan was so good partly because he never worried. He thought he was the greatest. And it showed, and his belief that he was the greatest made him the greatest. Pretty interesting stuff. Okay, Chrissy looks like is doing a follow-up on here. I'm talking of the symptoms of depersonalization. Okay, so this is when you're in trauma. Depersonalization, dizziness, foggy thinking, unable to think of things other than feeling that way. As a parent, it feels difficult to continue to function normally. It does. Listen, Christy, there's no question. And by the way, depersonalization is when you feel kind of disconnected from who you are. You don't even feel like yourself. That's what depersonalizing means. But when you're in that state, one of the things you have to do is lower your standards for the moment. You are allowed to be in trauma. You are allowed to have a hard time. Give yourself that space. If it's not your finest parenting hour, that's okay. It's the sum total of your parenthood that matters. It does not matter if you're, not your optimal self all the time. So, first thing is take off the heat. That's part of not panicking, is to take the heat off of yourself. So, Christy's saying, thank you. I didn't realize that was trauma. I must have said something that made you think that. I actually don't remember what I said. I'm in the flow. So let me know if you need more help with it, though. Jasper's giving a little follow-up on his question. He says, agreed, my friend has a strong power column. Listen, if we can get you there, or not even if, when, you will master that symptom. And I'm looking forward to that. Okay, Jill says, okay, it looks like there's a couple of different parts. So I'm gonna read different parts. Courtney, I'll just read it off. So Jill says, will I be able to get better? Oh, wait, hold on. Yeah, this is the first part. Okay, Dan, working on the doubt column. Are these questions okay for that column? Why do certain movements always cause me pain? Will I be able to get better when so many things have not previously worked? Is there a problem with my personality that won't allow me to get better? Okay, Courtney, leave these up, okay? First of all, there is not a single question that you would bring up that's not okay for the doubt column. Remember, one of the 4 things that is doubt is questions. So these are your questions. They're totally fine to ask. And I will say this, and hopefully you'll feel good about this, Jill. They're excellent questions. All 3 of them, fantastic. I want to help you resolve them. I'm not happy that you have them because it's hard for you, but we'll work on them. So, and I'm going to try to answer them, but I want to take a look and see what you said down the line. Because you said, oh, I see. Courtney, you actually organized this into its parts. Perfect. Well done. All right, leave it up there. So I'm going to answer these questions then. First question was, are these okay? Absolutely. They're spot on. So why do certain movements always cause me pain? This is almost exclusively because of your belief system. When you believe a movement will cause you pain, it will. And remember, doubt is looking for a very plausible explanation for pain. It's looking for places to hook in. And this is one of those. So the thing to do, if you can, is to start slowly challenging those movements. And when you're doing those movements, actually think, this is a trigger. I can actually do this. And a lot of times it starts to move right there, just from the challenge. If it doesn't, by the way, that's not confirmation that this is a purely physical thing. Again, very few things are purely physical. And purely physical things heal within 12 weeks at worst. A lot of times much faster than that. The body's very good at healing, and it's especially good at healing when we're relaxed. I've worked with people before on things like rectal tears. Now, you wouldn't think necessarily that I can treat rectal tears with a mind-body process, but I actually can, and I have successfully, and here's why. If you can get people to relax, the body just heals. Rectal tears usually heal within 2-3 days. Amazingly, they heal that fast. When they're slower to heal, it's because there's tension, and that makes for, taut skin and muscles and all that. It can lead to a lot of ripping, things like that, just from the stress of it. I'm going to finish up with Jill's question, then I'm going to get to Terry's question on Instagram, and then back to some questions on YouTube. So the other questions Jill asked, will I be able to get better when so many things have not previously worked? Well, if I'm doing my job correctly, Jill, yes. And the reason is I'm giving you new information. The columns are new information. They're certainly newly packaged information. I don't hear anybody talking about it this way, and I don't see how they would because it's pretty unique to how I've understood it. But the fact is you're getting a lot of new information. And if you keep letting that information wash over you, that will get better with time. We just did a testimonial with a woman named Patty that's coming out soon. She talked about the information, just, she let it wash over. She trusted that it would go in more and more. So the reason you can believe this could go differently is because it actually is a different treatment. It's set up differently. There's different information. Something has to be different for it to go different. So try to think about it that way. You're getting different stuff. That can give you a lot of hope. Last question she had was, is there a problem with my personality that won't allow me to get better? This is a very common experience. That's what I call level 3 doubt. And we work on it mostly in the power column. There is no one that has a personality that prevents them from getting better. No one. There are personality traits that can get in the way. In fact, my troubleshooting PDF is all about that. It's about identifying different kinds of things that can get in your way. But those are just problems. They're not things that will actually stop you. They're just problems that need to be addressed. So, Jill, I hope I answered your questions well. You let me know. Okay, question coming from Instagram, which is from Terry. Do you ever challenge or try to enlighten your doctor during your annual visit? I get the feeling that most don't want to hear about it. That's a great question, Terry. I generally don't. And, it's funny. I mean, I would try to subtly. But what I've done instead is I actually try to find a doctor who's already a little enlightened. Because, this is somebody who's supposed to be taking care of you. So it's not particularly fair that you should be having to take care of them. So I would rather, Terry, that when you're actually interviewing doctors, you ask about it. You find out what do you believe about this? Now, most of them are not going to be particularly well educated about it, but if they're open to the idea, then you stand a better chance, ironically, of not wasting your time when you're talking to them and saying, okay, well, I'm going to try to get you to see these kinds of things. Or you might say, I read Dr. Sarno, or I watched this podcast with, Crushing Doubt, whatever. You don't have to recommend me, but you certainly can. The thing you want to do is find somebody who already has the baseline ability to listen about it. Now, look, you're going to find some people out there some doctors who maybe weren't aware of this in the first place, and you do help with them. And we're doing a service to talk about it. So I actually do always try something, but I would also encourage you, don't feel that you've got to expend a huge amount of energy on it. It's the doctor's job to take their job seriously. And meanwhile, I'm working on it. So I'm putting this information out there. You don't have to do it all yourself. But I would say, sure, put in a plug for it, but mainly so that you can feel confident that the doctor is going to see these things instead of sending you down a worry rabbit hole, which they can do. Hope I answered that question. Okay. We have a question from YouTube, Robert McNellis. And, okay, there's two different parts, but you combine them? Great. Thanks, Courtney. All right, here we go, and let's leave this up. In my experience, most of my chronic pain conditions eventually go away, even if it takes more than a year. I believe it is primarily due to pain indifference. The emotional distress behind them often stays with me, hoping that the column work could really help with that and the duration of the symptoms. Okay, great observation, Robert. And or I actually think you called yourself Bob in here, so good observation, Bob. But I think that really is true. Most supposedly chronic conditions do eventually go away. And if you think about it, that's pretty strong evidence for the fact that they're mind-body experiences. I suppose you could say, well, everything heals, but it's not often the case that there's a pattern where there's a problem and then it does heal over the course of a year. That's not normal. I don't mean that, in any way maligning people who've had symptoms that way, but it's not normal from a logic standpoint. And I think Bob is catching on to that there's something going on that changes in his mind that frees him up. Now, he is saying it's pain indifference, and that can work for a lot of people. It's a way out. And the column system is designed to have multiple ways out. Pain indifference is something that Dan Buglio talks about beautifully. And he talks about really two aspects, if I'm remembering correctly. I think it's fear and indifference. Mastering fear and getting indifferent to the pain. Or no, actually, he focuses on attention. But that's another way of getting it indifferent. So those are two great things. They're great solutions. And in the mind body community, you're getting a lot of solutions from a lot of people. What I like about the column system, and, Bob, you're hoping that it can end the duration of the symptoms or change this profile. It absolutely can. You have been working with the materials and the resources that you have had at your disposal. These are new resources that can speed things up. And in moment-to-moment thinking, which is a big part of my columns process, you can start to recognize that you can change pain very quickly. In fact, during the course of this Q&A, I have made this pain up here go away. Ironically, it's moved over here. But it's a start. And, I do all kinds of things to get myself better from it. But one thing that I am very certain I'm not going to do is I don't panic. And it's because the columns provide a system and a whole setup that I can fall back on. I built it for me originally, and now I'm passing it on to you guys. So it is a way that I can always calm down and say there's always something that can be done. For the onset and uptick in symptoms, I'm going to look in the emotions column. For those consistently acute conditions, I'm going to look in the doubt column. For the plateaus or the doubts about the self, I'm going to go to the power column. It's great to have it set up that way, and I'm 100% confident this can help you get a long way on this. So let's stay in touch about it, Bob. Okay, Dorisa is saying, we're discussing cholesterol. I think I missed that. Hold on a second. Okay, Molly said my LDLs, which is a cholesterol measurement, are always high. That freaks docs out. I have high good HDL too, but the docs focus on the number being high. However, no heart disease in my family. I won't go on statins. So this is a great observation, and it is one of those things where doctors they're confusing the measurement with the cause. Measurements are important, but people can have things for multiple reasons, and they can have them for multiple reasons. I mean, think about white coat hypertension is when people have high blood pressure when they see the doctor. Now, doctors have caught on to this for the most part, but interestingly, they've caught on to that, but they still don't seem to think that the mind-body process is hugely affecting things, even though they see it all the time. But white coat hypertension is a good example of how we really need to be careful not to overinterpret what we're seeing. If you have lots of risk factors for things and doctors are telling you to be careful about something, listen to them 100%. But if there's just one measurement that's completely not aligned with other things, it could be, it probably is completely incidental. So listen to doctors about life and death stuff, but keep in mind that there are incidental findings. Now, Dorisa was responding to that. She said, I also have high cholesterol. They want me to retest in a couple of months. So follow up on those tests. Yeah, go ahead. But, I've had the kind of cholesterol issues where the like exercise ones are too low, and they're like, you got to exercise more. I'm actually exercising a fair amount. So sometimes these things don't make a whole lot of sense, and they are genetic. I'm going to back up. I don't want to sign on to the idea that they don't make a whole lot of sense. I hate random theories, as you know. So it doesn't make sense to me yet. I do believe it can be made sense of, so we'll return to that. But it can be genetic. It can be incidental. One thing's for sure, I do not feel that Western medicine these days has a very good beat on what is happening at all. And that if they can bring in the mind-body process, or we can bring it to them, so much the better. So we'll keep working at that. Okay, let's see. Jill and Molly are connecting on having some similar issues. Now, Bob looks like has a follow-up. My physical job is a blessing and a curse. I have to use my body, so I can't dwell too long on every pain I have. But when it is bad, it really makes my job more difficult and unpleasant. It can be really hard. Mind-body issues, even though they come from the head and become real in the body, they do become real in the body. It can be very, very hard. You can have days, let's say, where you have shoulder pain and you got to lift up your kids. One thing you can remember, though, that could be helpful to you, Bob, is you actually can't do damage. This is a benign, reversible, but very painful process. Pain is horrible. It sucks. But you cannot damage yourself. You really can't. You know, the only way that you can actually get damage is through a blunt force collision. So the good news is, even though it hurts, it's not going to harm you. And if you start thinking about it that way, that will actually relax you and bring down the pain. But in the meantime, Bob, you can also use the columns. If you're having a pain at work, you can know, is it emotions? Is it doubt? Is it power? And then you can make a quick action step. Once you have the columns in place, they're designed for quick action. And you could get relief right in that moment. Every moment is a chance to get relief. Okay, we've got a question on YouTube about Advil. Let me see. Where was that? Oh, you have it queued up? Let's bring it up. So this is from Jill. Why does Advil help my butt/leg pain? I've tried cutting back on Advil. I take it twice a day, but the pain is too strong right now, so I've gone back to taking it twice a day. This is a great question. All these questions are great, but here's what I'd say about it. This is a really tricky one. And the reason it's really tricky is that Advil does actually do things. It reduces inflammation. It can bring down a fever. It can do lots of anti-inflammatory things. When it comes to pain, though, there is a question that I will tell you is an open one in my mind, because I used to take Advil for my back pain. I used to take it all the time. I was taking it multiple times a day. Then eventually I cut down to twice a day. And then eventually I cut it down more and more. But when I was working with the chiropractor, I was working with the one who eventually recommended Sarno to me. He eventually got me to wean down on Advil. And I could not believe it, but the more I weaned down, the less I needed. And that did not make sense to me. So I kept following that. And eventually I got it to a place where I could not take Advil and have the same amount of pain. Well, that does very much speak to a mind-body experience. So I would say the reason that the Advil is helping you, I'm a little hesitant to say this because I don't want to take away something that works for people. Use what works, but giving your question a candid answer, it's a mind-body experience. Advil actually does not work for me on pain anymore. I wish that it did. It would be great. But the fact is, I know too much about it. The good news is I have a better system in place that helps anyway. So it used to be that when I would get a headache, especially, I would have to take Advil or I'd have to go to sleep. Those are really the only two ways to resolve it. And in the end, I now have a better solution. Advil may not work for pain. It does still work to reduce fevers, by the way. And sometimes I even take it when I have pain. But my mind is just like, no, come on, Dan. You know better. So the good news is you can replace it with a system where you can get control over it, and the column system is the way to do that. So that could be a controversial one. Let's talk about it as needed. Okay, let's see. We got a lot of things in the works here. Hold on a second. There's a whole conversation going on here, so I don't want to read out the entire thing. Molly does observe this. Advil can cause kidney failure, so be cautious. It is true that, long-lasting Advil use can be damaging in some way. It tends to take a lot to get to that point. But I think that you want to reduce the Advil as much as you can, but do not be hard on yourself for taking it. Okay, so I would say this. Eventually, we can get you off of that, reduce it some. And in the meantime, there's plenty of help for this. The columns work will help. Now, we're going to have to wrap up shortly here, guys. And there's lots of questions we still have going. There's lots of things that we want to talk about. We're getting lots of questions on here that are not typical mind-body questions about Pokemon and Belgium. So I'm going to leave those alone, but if I'm missing something, you let me know. what I want to tell you guys is in terms of our schedule. Oh, by the way, I see Jane. I see you on Instagram. Thanks for joining. So I want to tell you in terms of scheduling. Next week is the first week I'm taking off in a while. And, I practice what I preach. I'm always trying to tell people, do the things that, there's some very strange questions going on here. You guys should check out the YouTube feed. It's pretty hilarious. So I practice what I preach. We have to take care of ourselves. And I'm going to give myself a little bit of time off, even though I love doing these Q&As. It's nice to, get some time away. Now, I'll take one last question from YouTube. Actually, I'm going to take two. Julie Eby says, keto has helped the keto diet has helped my husband with high cholesterol. All my family has genetic high cholesterol. I do not, but I'm keto too. We limit our good fats. So there's lots of things that you can work on to change what's going on physiologically and in your mind. But I will say, overall, the mind is incredibly powerful. Now, one last comment. This is from Jill also. I can't wait to use your system instead of Advil, as I really dislike taking any meds over the counter or prescription. I get my blood work checked periodically to monitor kidney function, so that's good. So far, so good. So yeah, just keep monitoring that. Anything kind of life or death, you want to monitor that. But in the end, I want to encourage you all. This mind-body process is incredibly powerful, and we can harness it. And the columns are a great way to do that. Let me remind everybody about the various ways you can do that. Some of you have already taken the seminars, but the next seminar that's coming up begins August 16th. They're Monday through Thursday. They're usually in the afternoon Eastern time. They're going to start being 1:45 to 3 o'clock, so I can go to pick up my kids at the right time. But these are great ways to get all the information you need. By the end of the seminar, people are not usually all better, but they have all the information they need, and then we build a system. So I highly encourage you guys to check them out. Ask me questions if you need to. It's dan@crushingdoubt.org. And in the meantime, there are other things we can utilize. Certainly the Q&A. I'll be back 2 weeks from today at the usual time instead of starting late. We have a Facebook group, the Mind Body Connection group, and you can join that. And every Wednesday at 11:15 a.m. Eastern, you can come. These are some of our free resources. You can come and have a discussion with me, with the community, all that stuff. We also do, of course, have some various other paid options. I do group sessions on Fridays. Contact me at dan@crushingdoubt.org if you are interested in that or need that. Those do not have a wait list. I do have individual sessions where there is a pretty big wait list. But I do podcast sessions as well, and there's a shorter wait list for that. So lots of options for you guys. We'll keep working at the columns, and I appreciate you all. Thank you so much for joining me, and I look forward to seeing you guys in 2 weeks. See you soon.